Hey everyone, I'm Mario, co-founder and CEO of Osco Insurance Corporation. We did something very unique over the past 3 years. We started a health insurer in New York State. It all started with this. One of my co-founders, Josh Kushner, before the days of Oscar being his insurance corporation, he opened his bill, had no idea what it meant. It wasn't so much that he got an ugly bill in the mail. He was commenting on his bill being a reflection of the state US healthcare is in. In many ways, we like to think, many other people think, US healthcare is a broken system. It's expensive compared to the rest of the world by about a factor of 2. If you take all the rich countries in the world, the rich ones, mind you, Switzerland, Germany, France, and so on, you compare to what we spend on healthcare as a percent of what we produce in the economy in a given year, it's about twice as much we spend here, and we get nothing for it. And this healthcare system made sense in an old world, but not in today's world, really. The old worlds of health insurance and healthcare is one where corporations were buying insurance. Not people, not the people who actually use insurance and use healthcare, made decisions on how it should look and how it should be organized and so on. No, it was corporations, HR departments going to benefit consultants, going to brokers, buying insurance and then giving it to you, and you sort of like, better or worse, started using healthcare. So one of the most important things to learn about Oscar and how we think about the world we're in is we insure people to change healthcare. We are, if you will, a revolutionary disguise as the ultimate insider, an insurance company. That little dot there, that's us in the bottom right. And we operate in the broader insurance system, yes, but in the even broader US healthcare system. And that big bubble is what we want to have an impact on as Oscar. By being the insurance company, change the way the underlying system is wired and operates. And the world of today's healthcare is one that is most defined by the fact that the member is nothing. Doctors don't get paid for healing you, they get paid for treating you. Literally, when you go to the doctor, he produces a bill with line items where every single thing he does to you goes on a bill that we as the insurance company pay line item by line item, no matter whether it led to you getting healthier or not. Insurance companies do everything they can to acquire you and then everything to avoid you once they have you as a member. They don't want to really talk to you on the phone. You're going to cost them money in their low margin businesses. In Oscar's version of healthcare, the member is everything. We navigate, we explain, we simplify the rules of how it works. We start and we design something new with the member experience in mind we want to create. And we make sense of a system that to many people in the system, whether you're a member or a doctor or a hospital, doesn't make a lot of sense. Beyond that, with the insurance company, we make the rules so we can simplify them. We make sense in the sense that we manufacture sense. A bad doctor shouldn't be on you to figure out who that is and Google him and avoid him, whatever. He shouldn't be in our network. We can create that reality that will allow you to get better healthcare as the insurance company. And with everything we do, we have the ultimate experience in mind we want to create for the member. Not some other weird system constraints. This is a weird thing to say as a, product company or technology company or insurance company because it is so foreign to really how everybody thinks about building products. Why wouldn't you start with a member experience? Well, the reality is in healthcare, most things are not built around the member. They're built around weird constraints the system itself put on itself. For example, many insurance companies don't think they should invest into your wellness as a member because they think you leave them too quickly. Bit of a catch-22, because if you don't invest in people's wellness, they probably will leave you too quickly. We give you free bundled visits and free televisits as parts of every one of the plans we have. We make these things simple. We want to start with that experience for you. And all this adds up to one very simple insight. Oscar needs to be the entry point to healthcare for members. That's how we design everything. We would love it if, as a member, you trust us to the point where care starts with us and care ends with us. We can get you a recommendation for the best doctor you want to see for the condition you have, where you come through the mobile app when you want to find an urgent care clinic close to you because you have something that just needs to get seen by a doctor right now, where if you have a chronic condition you don't know what to do with, you talk to one of the nurses quickly, you can then get you in with a doctor very quickly. We had a few people who left us at the end of 2014. Not many, but there were some. So we called them all up and we asked them, what were we missing? What didn't we do that you wanted us to do? And this is a very typical quote we get. I loved Oscar like no other, but I got a better rate with the comparator. And we're talking about differences of rates here, of monthly premiums, in about $20, $30 or so. Nevertheless, this smaller amount in cost was so important for members that they turned away from us even though they liked our service. Which means we will be successful as a company next year and in 50 years from now if we can get our prices down. If we can do this, we will eventually just be an elite luxury niche concierge plan, which is not the business we want and not the mission we want to follow. We want Oscar to be affordable for everybody who needs to get great healthcare and great health insurance. There's two reasons for this, really. Number one is price drives membership. If you go into healthcare.gov, where you can select plans, the first thing and the only thing really you see about insurance companies is what they charge on a monthly basis. This becomes your proxy for everything else almost. And difference of $20, $30 or so matter a lot. But the second reason really is, and this is a bit more of a subtle reason, price in the way our business works really is just a reflection of how good we are at managing your care as a member. Because most of our price is actually just driven by the healthcare costs of our members. If you get healthier more quickly once you become an Oscar member, that is what will help us make the insurance more affordable for everyone in the membership base. US healthcare is on a crazy inflationary path of cost increases. If it continues to be in the same path it's been in for the past 20, 30 years or so, then by 2050, half of what we produce in this country will be healthcare. Half of your income will go to your healthcare. That can't be the path we can stay on. We have to, at Oscar, help to make plans more affordable, and we have to do it by getting you healthier more quickly. A quick detour on how our business actually works. This is a bit of a look behind the scenes of how an insurance company operates. Of $100 we take in premiums, we pay out about $85 directly for medical spending. We use about $12 to pay for our own operations, meaning our engineers here, our customer service agents, our claims processors, and so on. A little bit we keep as a profit, about 3% industry-wise. Now let's dig a level deeper into those medical costs. Here's a way we can break those down. Risk per member, first components. The word risk is a funny one here because we use it because every insurance company talks about medical risk that way, but it sort of implies, again, how insurers like to think about you as a member. You're a risk to them almost. Apologies for the terminology here. It's the way, essentially, insurers call the amount of health conditions you have as a member. Utilization per risk, then, is how many times do you end up using the healthcare system if you have certain conditions. If you have the flu, do you actually go to the doctor or do you stay at home? And then finally, cost per utilization is what we end up paying per you going to the ER, going to the doctor, and things like that. I'm showing you this because it beautifully illustrates that there is an old school way of managing risk, getting costs down, in a Oscar way, a new school way, so to say, of doing things. On the risk per member, what insurance companies love to do is what they call underwrites, which basically means not lets you in as a member if you look like somebody who'd be too expensive to insure. We think about risk per member in a different way. We think that we can actually get you over time healthier if you join us. We gave every member of Oscar this year a Misfits, connects to your mobile application right away and pays you $1 a day if you walk more than a certain number of steps. That's investing into wellness. The US general surgeon thinks if you walk more than a few thousand steps a day, you're going to get better over time. It's the investment we would love to make into ourselves, into our members. Utilization per risk, again, how many times do you actually go to the doctor per something being wrong with you? The old school, the old way of doing things, to deny stuff, to not even let you go to the doctor. The new school way of doing things is to manage care in a better way. We have nurses on the team here, we have doctors on the team here as well. We take phone calls to members, we proactively reach out to members who went to emergency rooms, who have chronic conditions, we help them navigate their care, and as a result, we think tons of better outcomes can be achieved by just somebody explaining to you in a better way how US healthcare operates. Finally, cost per utilization. The old school way of doing things is just say, hey, we're going to recontract some providers here. One of the first data analyses we did at Oscar was we looked at about 6 years worth of medical claims of doctors in New York City, and you couldn't find any connection between the quality of care you'd get as a member and the cost the doctor would charge you. It just wouldn't be correlated at all. If you buy an expensive car, you have some reason to believe it's going to be a great, fast, and probably even safer car. Not the case if you pay for an expensive doctor. Some are great and amazing. Some are not so great and amazing. And so one of the things we do, as opposed to just recontracting, is also to just reroute, help you get to the doctor who has the best combination of total cost of care being affordable and getting you healthy the quickest. A uniquely possible thing in a convoluted system like US healthcare. And the key to understanding all these things is, you ask yourself, why didn't anybody do this before? The answer really is, insurers have tried. You probably have received a flyer in your mail if you are parents that encourage you to kind of vaccinate your kids, which is very important to do. But you probably discarded it, didn't really look at it because it came months after you maybe should have taken your kids to the vaccination. It wasn't really very personalized. It didn't really speak to the situation you were in. It didn't tell you who you can go to get your kids vaccinated. The key for all of these things is start with member engagement. Get members to trust us and the help we can get them, the assistance we can provide them. And so, for example, in the case of vaccinations, we call members up who we see haven't vaccinated their kids, and we actively explain them who they can go to, what this will cost them, nothing by the way, and how all of this will work. And it really leads to what I think is one of our biggest bets, if you will. Member engagement reduces costs for everyone. Better wellness, not more rejections is what we want. Better management, not just more denials. Better routing, not more negotiating on the back ends. Those are the things we want. They speak to members. They make you feel like you have a better experience and get better healthcare. And in this odd combination, almost doesn't exist anywhere else outside of healthcare, it actually reduces costs over time. Our biggest challenge, and simultaneously our biggest opportunity, is that what we do is we sell access to a cumbersome US healthcare system. Because if what we sell sucks, then at best we can suck less. And that's not a great starting point, that's not a great situation. But as the insurer, this is the opportunity part of it, we have unique superpowers in rewiring the system. We can change the underlying healthcare system. We can make it less cumbersome. And that's really what we're here to do. So one of our main design tenets is we have to be end-to-end useful. Not just usable, and not anything less than end-to-end. You are, as a member, going to judge us against your full experience of using healthcare. Only then can we truly be your entry points to healthcare. Otherwise, it's like an iPhone without the apps, and the apps in our case are all these highly motivated, super smart, super engaged doctors, hospitals and so on who want to get you healthy and whom we can help to get you healthier. And we do this by selectively using our technology and our member engagement to make doctors happy. Oddly enough, healthcare is a system where nobody's really happy. And we have sort of like had a mutual armament to the point where everyone is hawkishly watching what the other party does without constructively working together to get people a better outcome. Doctors spend about 30% of their dollars to collect their dollars. And we, as the insurer, are frankly a major driver for that. We put in place gates like pre-authorizations. We have deductibles that make it a little harder for the doctor to bill you. So let's get rid of some of these things. For doctors and hospitals, we work very closely with. Last year, we got rid of a whole bunch of our pre-authorization requirements around certain procedures because we noticed there were a tiny fraction of doctors who were not sort of like using the procedures very well that are underlying this, but the vast majority did it well. So rather than denying care or authorizing care for everybody out there, those doctors whom we can just reduce all this friction for, make our members happy in return. We can get to same-day appointments. We can encourage them to join our televisit practice. We can do better care management. And in return, we can get more members to go into their practice and see them. And again, healthcare is such a unique system in that you can simultaneously build a better product and lower costs when you do this. You can get better member engagement and a lower price as a result, because consumers more and more demand what they should demand all along, which is better healthcare for lower prices. We take risk. We don't just sell tools. We insure ourselves. I love the fact that I now can call a doctor at 2 a.m. in the morning for my 2 little kids when I forgot exactly what the dose of Tylenol is you should give when one of them has a fever, for example, or when I'm worried about this weird cough that they have or a weird rash that they have. I can take a picture, send it to a doctor, he calls me in 10 minutes, it's totally free, 24/7. all year round. He can prescribe, he can diagnose, and so on. Oscar became the first insurance company in the entire exchange marketplace selling to individuals to ever do this. And now more insurance companies are doing, and that's great because we want to have an impact on how, again, the system is wired. But this innovation, this sort of like rewiring the system only works if we actually are better off as a company, if we can get you as a member happier, healthier, more quickly. And because we think we do it well, and because we think we've innovated by doing it, we want to increasingly teach the system how to take risk. The system is one that's built on fee for service. That's this payments for every single line item on the bill. It misses the incentives, the financial incentives for doctors to get you healthier more quickly. It's missing information that's disseminated more easily between your doctors, for example. Your doc doesn't see when you go to the emergency room in between 2 visits you have to your doctor, to your primary care physician, for example. He would love to see it. He would love to see it that you're taking your drugs he prescribed for you. He can't see it right now. We can, as a technology-driven insurance company, be the catalysts to bringing providers into the world of taking more risk on you. What that basically means is that providers who already kind of like became doctors because they want to get you healthy now also have another financial nudge to get you healthy, which is just smart for everyone in the system. US healthcare is moving into that direction. And all this really is summarized in a really simple chart. We sign up members. We work incredibly hard to make them trust us, engage with us. We ask them after they sign up right away, do you have any conditions we should be aware of, you need help with, for example. When you say so, when you say you want to engage with us, a nurse will call you right away, talk you through your treatment plan, talk you through whether you have a doctor you're happy with or whether we can help you find one. We can then help you navigate care. We can know the most about members and share this information back with your doctor. That doc who calls you back when you push a button in the mobile app for free knows your health history because we push it to him before he picks up the phone and calls you back. We can create, as a result of it, a better end-to-end experience of when you go and see a doctor in person. Because again, we can push information out. We can make sure you're seeing the right doc. We can make sure that any instructions the doc gives you come back into our own systems. And as a result of all of this, we over time, in the next year, but certainly in the next 10, 20, 50 years, can help get the cost of US healthcare down while improving the experience you have. And all of this, of course, will lead to signing up more members. And the best thing about this is, after doing this for 3 years now, insuring people for about a year, we can clearly tell it's working. We have now about 10% of members joining us because their doctor told them to join us. Oh, and by the way, 45% of members join us because their friends told them to join us. So we must be doing something right with both how we treat doctors and how we care for our members. And we are starting to see how the cost is coming down, how all this is working together so we can really be the most affordable end plan and best product experience that is out there in the markets. Oscar is the entry point to healthcare for our members. But we are successful when our prices come down because it drives membership, because it's a reflection of how good we are at treating you and getting you healthier. And we fundamentally believe that engagement reduces cost because we can get you better through wellness, better through managing your care in better ways, making sure you end up in the right doctor or hospital and so on for the right reasons. And we understand we have to be end-to-end useful to do that. Use our technology to make doctors happy. Use our member engagement to make sure you go to doctors who are going to make you happy, and help the system get the right incentives in place so all this works better. Thanks for listening to all this. If you want to have more information, just swing by here in New York. We're here. Everything we do is in New York in one building. You can talk to our customer service people, you can talk to engineers, you can talk to me and the other co-founders. We'll explain to you how we're trying to do all this and why we're only at the beginning of this probably 50-year or so journey. Thanks.